So I wanted to touch base on why you would get a chiropractic exam even if you have no pain, or why would you go in for a chiropractic adjustment when you have no pain? Because that is completely counterintuitive to the model of care that we grew up with. And I'll speak from personal experience that when I was younger, the only reason you would go and see a doctor was when something was really wrong, and he would give you a referral or he would give you a prescription, and then if you didn't get better, your job was to go back to the family doc, and sometimes he'd give you a stronger medication or he would give you another referral. And so I think that's the model of care that most people grew up with. And you know, the vast majority of people, I'd say about 80% of people who walk into this clinic, they're walking in because they're in crisis. Their legs going numb, their migraines are finally, that's enough, I can't get through a day. I had a new patient, her elbow pain, the pressure in the nerves in her neck was so high. And that's really the body in crisis. And, of course, we are going to be able to diagnose and treat and help those people. But if you've ever considered keeping well and investing in wellness, it's the reason why people go to yoga. It's the reason why people meditate. I think if you did a full audit of all the things you do for your health every day, every week, every month, and not just how much time you invest, but also how much money you invest in keeping yourself healthy and well, it's a considerable chunk of time and money. I can guarantee it, because everybody wants better health. So when it comes to your chiropractic exam, you can come in for an exam when you feel fine. Because when you're dealing with spinal stress, spinal stiffness, what we call subluxation in chiropractic, subluxation happens in your spine with no pain. Bad posture happens with no pain. There'll be pain with chronic subluxation patterns or chronic bad posture at some point, but people can go for years and decades without pain, and then of course the body hits crisis. Now, nobody really wants to wait for crisis, so the best time to come in for an exam is when you're feeling okay. And we use data, postural, physical, if we need to take x-rays, to get a real good idea of where your health sits outside of the traditional medical model. And from that, we can do one of two things. If your spine looks great, I'll tell you, you've done an awesome job, and my recommendations for care may be this. But if we find things that are way out of the normal and we can guarantee they'll cause you problems as the decades go on, we'll have a plan for that. Okay? So I hope that makes a lot of sense. And it's the same reason why people come for adjustments. The vast majority of patients come in here for an adjustment once a week, even with no pain, as I do with my chiropractor once per week, every Friday. And why do I do that? Because I can feel fine, but I can have stiffness in my spine that it takes a trained professional to put their fingers on, to do a spinal screen and do an adjustment. And I do think to maintain a healthy spine for life, the recommended frequency should be a decision made by you and your chiropractor based on your health history and your findings. Health history and findings are what we do in this office. If you're in the region and you want to learn more about how chiropractic can keep you healthy and move your wellness higher, give us a call. We're right in the Bayard Market. If this is an interest for someone friend, family member who really likes to take care of themselves and is willing to invest time and energy and money in keeping at their best, share this with them. Flag them on this, send us a message, and we'll get them in touch. And if you're absolutely nowhere near Ottawa, I'll refer you to someone in your neighborhood or in your area who can help you. So that's my sign off for today. Chiropractic can do wonderful thing with acute pain, acute crisis, but chiropractic's strength is finding you well, using data to get you to the best function you can possibly be. Hope that helps you guys. Signing off for today. Have a great week.